Hi, I'm Lizzie Parry, The Sun's digital health editor, and this is the Health List. First up, the UK has recorded the highest number of COVID cases on the planet, with India a close second. The meteoric rise has led more than 1,000 scientists to call on the government to slam the brakes on Freedom Day, going so far as to say the decision is unethical and unscientific. All this comes despite the UK's incredible vaccine rollout, with more than 34 million already double jabbed. So, why are some experts wary about the coming unlocking? Well, although lots of the country has been vaccinated, coronavirus is still spreading, with over 42,000 cases reported yesterday. Some scientists argue that given we have the jabs, more young people should be vaccinated before we unlock to prevent any further deaths and serious complications like long COVID. While the figures do look worrying, it's important to note the vaccines have drastically reduced severe infections, hospitalisations and deaths are much lower than we saw during January's second peak. A clear sign the jabs are doing their job. Good. Next is the news no Brit wants to hear. Alcohol causes cancer. A new study in The Lancet has found that 740,000 new cancers have been linked to alcohol in the last year alone, and that even with a low level of drinking, there is a raised risk of breast, esophageal and throat cancer. It's now thought that 4% of newly diagnosed cancers are linked to alcohol, and men make up more than 3/4 of those. So, how can drinking lead to cancer? When we drink alcohol, our bodies turn it into a chemical which can damage our cells and prevent the body from repairing that damage. It can also increase the level of some hormones, including estrogen and insulin, which have both been linked to a higher risk of the disease. Cancer research warn it's the alcohol itself that does the damage. It doesn't matter what you drink. If you're worried you're drinking too much, or a loved one is, it's worth speaking to your GP. Last but not least is a plan to tackle Britain's obesity problem, which could slim down your bank balance too. Government food czar Henry Dimbleby, founder of Leon Restaurants, thinks a snack tax is in order to slim Britain's waistline. He's written a report for the government advocating extra taxes on sweet and salty foods, which critics say will hit the pocket of Britain's poor. It could mean a pack of Frosties costing £1.16 more, Cocoa Pops would go up by 40p, and strawberry jam could cost 57p more. All that would add up to an extra £4.8 billion for shoppers every year, £172 per household. There's no denying that weight is one of Britain's major health woes. More than 1/4 of us are classified as obese, and the condition is one of the UK's biggest killers. It's associated with serious conditions like heart disease, stroke, some cancers, and even dementia. And these illnesses put pressure on the NHS, costing £6.1 billion every year. So why not tax the salty and sweet treats responsible? Well, critics of the scheme say it will have negligible effects on obesity, while hitting the poorest in society hardest by hiking the costs of their weekly shops. That's all for this week, but check back in 7 days for more health news.